thinking about a song that Chief Dan George made, and he's given it out to people to use, and probably be not singing the original one he sang, but I'll do my best. Oh, hero, hero, hey. Oh, hero, hero, hey. Oh, hilo, hilo, hey. Oh, hilo, hilo, hey, ah, hey. Ah, hey, la, Cooked me, anders ook niet op Jana gaan kopie, anders gaat anders niet land. Hoe moet ik zijn naam gaan kopie? Hoe moet ik lachen? Hoe moet ik zijn naam gaan kopie? My Jana. Thanking you, grandmother, for bringing us here and letting us be on this land. Asking for teachings and knowledge, asking you for healers, asking you to help all of our people that need help. And we look at people who were on this land for more than 20,000 years.
So ahora es por saber el plan dental que hay.
And at this time, there are people from all over North America that live in this part of the world. So I say thank you to those nations for allowing us to be here. Say Coachum, the Hoichko, Siam, to my relatives in North Vancouver. Coachum, all my good relations. Bye.
Thank you very much, Tom. Before I turn it over to Kimberly Lang, who will be our moderator tonight, I just wanted to remind you that this is being recorded and that it's going to go until 7:30 p.m. The format is we have some panelists who are each going to make a presentation. Then we will have some questions and comments from the audience. and then we will have some closing comments. Before I pass it to Kimberly, just wanted to let you know that in getting ready for this event, I came across an article by a woman named Ariana Shavishi, who's a Kurdish-British writer and professor of ethics at the Brighton and Sussex Medical School. And she reminds us that even in the UK, where they have had a functioning dental plan since 1948, that the funding is still inadequate to meet the needs of the people and has in fact been dropping in real terms. And the people in the population have to make up that shortfall. And now there are only about a third of the adults who are enrolled in this plan, and more than 2,000 dentists leaving in the last couple of years due to underfunding. And finally, the importance of the problem that tooth decay is the leading cause of hospitalization in the UK for children between the age of 5 and 9. This is a really very important topic, and the key to a functioning plan that is creatively organized and solutions oriented will be public input at events like this and from people just like yourselves. So with that, I would like to pass it over to Kimberly and invite her to introduce our panelists tonight. Thank you.
Hello, everybody. My name is Kim, and REACH has been connected to me since I was a dental hygiene student 27 years ago. I did my first outreach rotation to REACH clinics. So REACH has kind of always been in my heart. And I was really excited to hear that they wanted to put forward this public panel discussion because they are one of our community health centers in the province that has been advocating strongly for access to dental care for many, many years. And so I'm really excited to see that this panel has come together of speakers and that REACH is involved and that reaching out to other nonprofits as well. We have Lex Vitus on the call here from Vancouver Aboriginal Health Society. And as we go forward into the communication tonight, I'm happy for others to identify who they are and where they come from. But for tonight, we are going to try and get a bit of community input from people in the audience tonight with these 4 questions. So we're going to have a Jamboard activity at the end, which is kind of like a whiteboard. There's going to be a hyperlink put into the chat function, and you'll be able to click on that, and it'll open up a whiteboard on your own screen, and you'll be able to type in with little sticky notes, like with text boxes or even handwriting, to give us some input on some of these 4 key questions. And we're going to screenshot the outcomes of it and share it. And it'll be used by the board and by the outreach committee, and certainly Don Davies can take it forward, and some of our other people that are going to be sitting on the task force to design this new dental plan are going to be able to take some of this information forward. So I would really, really encourage people to take the time to write in this because it's powerful qualitative data of real people's needs. So please look for that at the end. So moving on to the next slide, here's just the outline for the evening. So we're just going to be moving into the panel presentations now with Sarah Clifford speaking first from the perspective of a patient in the nonprofit system. And then Don Davies, the MP, Member of Parliament for Vancouver Kingsway, who has been the key sort of advocate in the government to really be strongly advocating for access to dental care and has managed to get this to have influence on this confidence and supply agreement that has been put forward by Justin Trudeau and Jagmeet Singh of the Liberal and NDP confidence and supply agreement at the federal level to essentially announce the beginning of a national dental care plan. And this is critical because not since the Canada Health Act has this opportunity come forward. And at the time the Canada Health Act, dentistry and eyes and feet and ears all got left out of the Canada Health Act. So this is our first opportunity to have oral health, dental health be part of more of a national plan. And that is going to start off targeted for people with lower income, and starting with children and then moving into seniors and people with disabilities And so we'll hear a bit more about that from Dawn. And then Karese, you're going to speak from the REACH perspective as a dental coordinator of a nonprofit clinic. And then Brandon Doucet is going to speak from the Coalition for Dental Care as well. And they're a group of dentists and dental hygienists and other allied dental professionals, starting with our younger generation, really, that's leading this. So he'll have an opportunity to talk about their work and their influence here. And then we'll do the open Q&A from the floor for anybody to speak and ask questions and provide a bit of their insight. And then we'll move into the Jamboard activity at the end, which will be open this evening and probably until tomorrow for you to document your thoughts there as well in a very anonymous fashion. Nobody will know who's written it. It's going to just provide everybody's input. And then some final closure at the end. So first off, I just wanted to introduce Sarah, who's going to speak from the perspective of being a patient in one of our nonprofit clinics here in British Columbia, which is the Vancouver Aboriginal Health Society. And she'll have a discussion for you about what she would like to convey. So Sarah, do you want to start?
Sure. Thank you, Kimberly. Thank you, everybody, for having me. Thank you, Tom, for doing the acknowledgement. I didn't always grow up having bad teeth. I had great teeth as a kid. I had access to dental care. I had every 6 months, I always got a cleaning. I never had any cavities. But then when I was 15, my life totally changed overnight and my dad was killed and my mental health went really bad, like really fast. The moment that I found out about it, I vomited like profusely and it didn't stop for 3-4 years. I was really sick. And during that time, every time I'd go to a dentist, it would just be mostly blamed on dental hygiene. Even though I brushed my teeth all the time, it was just the erosion from being sick all the time. And then I had 2 terrible HG pregnancies where it was the same thing 100 times a day. Like I was on IV, I was in and out of the hospital, I was losing weight. I had 2 tiny 3-pound babies. I was so sick the whole time. And the more my teeth got really bad, the more stigma that I felt and the more I just felt really uncomfortable going to the dentist. So then when I was told about trying a low-income clinic, I went to the Vancouver Aboriginal Health Society, and right away, like my life totally changed. I don't have fear now when I go to the dentist. I feel treated like so much more humanely. As soon as I walk in the door, I'm welcomed. It doesn't matter how bad my teeth are. It's not ever going to be like a judgment thing when you go there. The cost effect, like the amount of work I've had done, I've had 4 different dentists over the last year alone and lots of different hygienists. The amount of work I've had done would have cost me way more than I could ever afford, but they've helped me with payment plans. They've helped me with what little insurance I do have. It's just been like quite incredible. A clinic like no other in my experience. I think like a lot of people feel scared and a lot of people feel trauma, especially when having dental surgery. Like it's not like a regular surgery. You get your mouth ripped open and then you go home. It's like there's no bridge, there's no discussion about the trauma that your body goes through when you have a dental surgery, and I've had a lot of them. But the supportive, they're always. Oh, I got some feedback there. Sorry, guys. Is it feedback for you?
I'm not sure why you're getting that.
Can you hear me though?
Yep.
Okay, sorry about that. Yeah, the level of fear has dissolved. I feel like comfortable getting treatments, and I'm hoping that soon they have enough resources to do pediatrics with their new peds rooms, because I feel like it would be good to. I'm a single mom for 6 years, so to get my kids really young to have dental care is not always affordable. You can do BC Healthy Kids, but they only cover so much. So to have access through Vancouver Aboriginal Health Society is going to be huge. Just for all the health benefits, like everything is tied to your dental, your plaque, your heart, your organs, your function level. Like everything is so important. I'm getting feedback again. had massive abscesses. I've had blood infections. I've had sepsis. Like I've had some major dental issues. And after the traumatic loss of my dad, I didn't have the funding always to go to the dentist. And now knowing that I can go in there and make a plan and get all the work done is
So,
been quite incredible for me and my family. So I just want to say thank you to them. And I want to say thank you to everybody who's involved in this process. And yeah, I don't know. I'm just grateful.
Sarah, one thing that is coming through to me from your story, and I'm trying to use the heart emoji, but for some reason it's not letting me. So my heart emoji is coming out to you right now. And as a dental hygienist, treating erosion on teeth from vomiting it's a very serious condition, and my heart goes out to you for the fact that you've had to manage that condition, and thankfully that you got the help from Vancouver Aboriginal Health Clinic. I think that speaks, a lot to what a community health center can offer, which often doesn't have that same pressure of the private model that we often see in the private realm. Now, one question that comes to mind, or the one of the messages that I'm hearing is, it's not just about financial barriers, but there's also anxiety and trauma there.
Oh, of course.
And how you're being treated.
Especially for low-income populations or anybody that has mental health or addiction issues. Like it's not an easy thing for everybody. A lot of anxious people can't even think about going to the dentist. It takes them a long time to get prepared for that. And then you look at like 60 Scoop survivors, residential school stuff, like there was so much trauma and so much stuff to do with dental there, and the fear of dentists goes down generations in our culture, and it's just I've had friends who have status. I don't have status, but I have a lot of friends who have status, and they get treated poorly when they go to a mainstream clinic because they're trying to use status coverage. There's like racial barriers, there's mental health stuff, there's a lot of barriers. It's not always financial, for sure.
Well, did we want to have a transition to the next speaker, Sarah?
For me?
Yeah. How are you feeling right now?
Yeah, I'm feeling good. You could transition if you like.
So did anybody have anything that they wanted to add to Sarah's presentation at this point? Okay, let's, I'm just having a bit of an issue with my screen here. I'm not sure why my cursor's not showing up. Can you advance the slide, Daniel?
I think that would be your computer.
Yeah, I'm just suddenly, for some reason, I'm just gonna for some reason, my screen it's not frozen, but it's kind of, the cursor has disappeared, and I'm not sure why. Haven't had this happen before.
I'll stop the share, and then maybe you can
Yeah,
you can
that would
reshare.
help. Maybe try that. There we go. There, yeah, my cursor's back. Okay, thank you. It was disappeared for a sec. Okay, so I'm going to transition to Dawn. Dawn, did you want to share from your perspective your work?
I would love to. First of all, good evening, everyone. I'm calling in from Ottawa on the traditional unceded territory of the Algonquin people, by whose grace I'm allowed to gather and work. I want to first of all thank REACH for organizing this wonderful session, and I'm honored to join my co-speakers. I'd like to thank Tom for that land acknowledgement, and I'd like to welcome all of the participants online. And first of all, I just want to thank Sarah for sharing. I'm always really grateful for people who have the courage to share their personal experiences with their health. It's an intensely private thing, and it takes a lot of courage and generosity, I think, to share. So thanks, Sarah, for that.
You're welcome. Thanks.
So I just want to give you a little bit of a timeline. I was elected in 2008, and I had the privilege of being named the NDP Health Critic in 2015. And to me, that's a very cherished role in our party, because the NDP, we consider ourselves to be the party of Medicare, going back to Tommy Douglas in the 1940s, who pioneered the concept of public health care in Canada. And of course, the NDP played a pivotal role in the 1960s in a minority government, interestingly enough, a liberal minority government, where we used our power in 1965 to, in 63 and 65, to cause the creation of a national Medicare system for all Canadians. So the story of dental care is I'll just tell you briefly. I noticed, when I was getting my legs in this, there's so many issues in healthcare, that Canadians are very proud of our healthcare system. We, particularly when we look at the United States, we think of our system as one where every Canadian has access to the hospital care and the physician care they need, regardless of their income status or their ability to pay. And I think it's something that binds us as Canadians, and we're very proud of it. But, the truth is that our system is far from comprehensive. Do a good job in terms of doctors and hospitals, and we do a terrible job with respect to a lot of other primary healthcare needs. Some have been touched on: dental care, pharma care, eye care, auditory care, mental health care are all not covered by our public healthcare system. So I introduced a motion in February 2018 at the NDP's 2018 policy convention, and it called for our party to advocate for the addition of universal coverage for all medically necessary dental care to Canada's public healthcare system. And later that year, and that passed, by the way, unanimously. So that gave us the political weight as a party to proceed. And in December of 2018, I had the Minister of Health, her name was Jeanette Petitpas-Taylor. She was 2 Liberal health ministers ago. There's been 2 more since. And I posed this question to her at Health Committee. I'm going to read it to you. Minister, at present, 32% of Canadians have no dental insurance at all, and approximately 6 million Canadians avoid visiting the dentist every year due to cost. Canada's most vulnerable people have the highest rate of dental decay and disease, but the worst access to this much needed health service, and that exists among people with low income. Given these stark disparities, what steps is your government taking to ensure that all Canadians can access medically necessary dental care? Here was her answer. We look at the Canada Health Act, Mr. Davies. We recognize that the Canada Health Act covers medically necessary services. With respect to dental care, we recognize that it's not covered under the Canada Health Act. Just recently, I appeared at the Seniors Caucus Committee here, and that was an issue that came up, an area that people wanted to look into. I would encourage the committee to possibly even do some work in this area. At this point in time, with respect to investments in that area, no federal investments are being made. So I was pretty shocked. By the way, that was the first time that dental care had been mentioned in Parliament in the previous 10 years. Mm-hmm. So I proceeded to say this is not right. Of all the things we'd been working on, pharmacare and making sure all Canadians can get access to the pharmaceutical prescriptions they need, but we also thought we would do dental care. These are the 2 major gaps in our public healthcare system. Now, why dental care? I want to be really clear about something politically and from I think a health point of view. Dental care or oral health is primary health care. I'm going to repeat that. It's primary health care. It's not a luxury. It's not cosmetic. It's not optional. I'm going to show you a picture, if I can bring it up quickly here. Okay, now I'm having technical problems. Where is it? I had it. Oh, there. No, I got it. I'm hoping you can see this. I'm just going to hold this up. Can you see that?
Oh, yes. Yes. And maybe go left or right, because you're there. Yeah. So that's the top of somebody's teeth. And it looks like the gum goes up quite high on the corner there with some really significant amount of plaque and tartar, and the gums are very red.
Right. Now, when I see a picture like that, if that abscess or infection or area was on any other part of your body but your mouth, if that was on your finger or on your earlobe or on your nose or on your liver, you would be taken to hospital and that would be repaired and taken care of. So it's not. So dental care, I think it's important that we understand, is a fundamental healthcare need. It's already been pointed out, I won't belabor it. It's linked to serious health conditions. It's linked to cardiovascular problems, diabetes complications, myriad of conditions linked to poor nutrition when you can't eat properly, low birth weight, premature birth in women, respiratory issues, they're even linking it now to certain forms of dementia, and pain, chronic pain. It's also a mental health issue. I think that when anybody has problems with their mouth, it's related to one's psychological well-being. Our face is what we present to the world. It's a class issue. 50% of low-income Canadians have no dental insurance. The majority of seniors over the age of 60 in this country have no dental insurance. So basically, what we have in Canada, if we're being honest as Canadians, is we have two-tiered US-style access to dental care. If you're rich, you get it. If you're working and you're lucky enough to be covered, you get it. If you're poor, you don't. If you're working and you don't have benefits, you don't. And I think that's a national disgrace. The numbers are staggering. About, as I said, 32% or 12 million Canadians have no dental insurance. But if we're honest, many more are affected. Many more Canadians have intermittent coverage or inadequate coverage where there's co-pays or annual limits, etc. There's a gendered issue as well. Income-related inequalities and access to dental care are greater in women than men. We've talked about children, and we had the British figure, I think, was given earlier, but that's also the case in Canada. The most common surgery in Canada on preschool kids is dental decay related. And in terms of youth, Canadians 18 to 34 are most likely to report cost as a barrier to dental care. So probably, if we're really talking turkey, about 15 to 20 million Canadians have inadequate dental care. And the costs of inaction are not only in pain and individual suffering. There's an enormous economic consequence because people end up in emergency rooms where they don't get the care they need, by the way. There's health complications I pointed out, and there's lost productivity. I want to point out that in 1964, there was the famous Hall report done by Chief Justice Emmett Hall, who did the study on healthcare in Canada. And people may not know that dental care was intended to be part of our public healthcare system. In fact, in that report, it says it's one of the highest priorities of healthcare. And what's even less known is the reason it wasn't put into our healthcare system then was only because we didn't have enough dentists to deliver services to everybody in the country. That's not the case today, by the way. So here we are today, 60 years later, the better part of half a century, and we're struggling to get public coverage started for just our most vulnerable groups. So I want to just tell you briefly before I sort of wind up is I want to move to what we've done about this. I mentioned that we got healthcare in the 1960s. The last time Canada had two consecutive minority federal governments headed by the Liberals, where the NDP held the balance of power, we got healthcare, old age security, and the Canada Pension Plan, among other things. Here we are, fast forward to 2021. The next time we have two consecutive Liberal minority governments headed by the Liberals, where the NDP has a balance of power. We only have 25 MPs out of 338. We decided it's time to strike. It's time to use our balance of power to try to get some gains for Canadians. So we negotiated the Confidence and Supply Agreement. It has 24 separate progressive policies in it, some really important, some medium important, some not so significant. But the flagship signature piece is dental care. And what did we negotiate? Well, we negotiated that all children under 12 would be covered for dental services this year. Next year, we would expand that to children under 18, seniors over 65, and people living with disabilities. And then in the next year, 2024, we would expand it to everybody who makes under $90,000 a year. It's basically, if you make under $70,000 a year as in your family income, you get covered completely. And then there's co-pays between $70,000 and $90,000. So if you made $80,000 of family income, you would get half the coverage paid for, and then it fades out at $90,000. Now, by the way, this is not what we wanted. We want universal coverage for every Canadian through our public healthcare system. So we regard this as a first step so that we could at least get coverage for, we estimate now, about 8 million Canadians who do not have dental insurance now. So the criteria are you don't have dental insurance and you make family income under $90,000 a year. I want to give you a little bit of inside ball. Just today, Parliament rose for the summer, and I had a meeting this morning with the health minister, Minister Duclos, and someone from the Prime Minister's office and our team. Here's what we have are driving towards. We have set as our guiding principles, we want this program to be 100% federally funded, and we want the program to be 100% federally administered. Now, I want to just talk for a moment about why that is the case, because most people think healthcare is delivered through provinces. The reason that we want to do it federally is because this would allow coordinated eligibility determination with Canada's Revenue Agency. Remember, if it's going to be family income of under 90,000, the easiest way to determine that is through the tax returns. So you have two federal departments talking to each other. It avoids the need to bargain with the provinces. I'll just be honest with you. If we involve the provinces at this stage, we'll still be talking about dental care in 10 years. It ensures consistency of services across Canada. We want to make sure that if you live in PEI or downtown Vancouver or Manitoba or Nunavut, you get access to the same services. It creates the best conditions for expenditure control. We will enjoy the efficiencies of centralized administration. It avoids provincial mischief because, again, if we're honest, there's provinces headed by Conservatives that don't believe in public health care. They don't want public dental care. Alberta and Saskatchewan already have said that. And it retains federal political control. And finally, it avoids contamination with the Canada Health Transfer. So what we've done is we are working really hard to take an existing program that exists in this country and modify it so that it can be delivered in time. I got to tell you, doing anything in 6 months or 18 months in this country is like lightning. I mean, the bureaucrats, the first thing the bureaucrats said to me is it would take 7 years to do this. Then they told us that it would take 3 years to do it. And we've said, well, you know what? World War II was completed in 6 years. So, we simply don't accept it. By the way, there's a funny story that I told the minister today. Tommy Douglas in the 1940s, when he was establishing healthcare in Saskatchewan, the bureaucrats came to him and said it was impossible. It couldn't be done in this time frame. So he looked at them and he said, well, that's the time frame. If you can't do it, tell me now, and I'll find myself some bureaucrats who can. Look, we're not designing a Land Rover to go to Saturn. We are looking to add people to a dental care plan and provide them with primary dental care services. So I refuse to believe that we can't get this done at least within the next 18 months. So what we've done is we've picked a national plan and we've modified it. I'll tell you, my word for it is I'm calling it Smile Canada. I can't claim originality for that. It might have been Brandon Doucet, my colleague here, but we're calling it Smile Canada. It will have no co-pays, no annual limits. I want this, by the way, to also have an excellent fee schedule, not only to respect all of the dental practitioners, the dentists, the denturists, the dental assistants, the dental hygienists. But this is not going to be a poor person's plan. This is a normative plan where when people walk in the office, they are treated the same as anybody else, and they have a plan that's as good as anybody else's. We are proposing a scientific review committee that reviews the policies on an ongoing basis and recommends changes, because no doubt when we bring in the plan, it won't be perfect. And I want to make sure that we have a chance to adjust it. So that's kind of where we're at. I also think it's important to have a mandatory 3 or 5 year review, so that we can bring the plan in and everybody can sort of not be super tense that, you know, we didn't get it exactly right, because this is a very ambitious time frame. So we want to make sure that we have a chance to really examine this so we can make improvements, so that it will it'll basically be a program that's of ongoing examination. So we're really proud of this. I think this represents the largest expansion of Canada's public healthcare system in 50 years, like I said. And like I say, we are not giving up on our dream of making sure that dental care is added to the basket of covered services under our public healthcare system. This is a down payment. We're not stopping until the entire bill is paid. So thanks very much, and I look forward to any feedback or input that you have. I think you're going to see my contact information. If any of you on here are too shy, or you want to reach out to my office and talk with me, or email me, or send me your thoughts or suggestions, or share your experiences, I value them very much, and it's really helpful for us as we try to craft this plan as we move forward. Thanks very much.
Thank you, Don. That was, you know, it's interesting. You should have been a dental professional. You speak like a dental professional. You have the lingo, you understand the issues clearly, and you're coming from the heart with it. Like, you know, you're, you know, it's not often that you can see somebody that's a non-dental professional come forward that can speak so eloquently about the issue. So I feel very confident that you're taking this message forward in a way that's having significant influence and impact, which is clearly what we're seeing as an outcome. I don't know how so fortunate that we came. What brought you into this understanding of the need for dental care? There must be an underlying story, or is it just listening to your constituents?
Well, thank you for those kind words. Well, you know, I got to tell you, I think on some level it started as a child. I mean, I remember, you know, I come from a working class family. My dad was often unemployed. My mom was a part-time school secretary, and we didn't often have dental coverage. And I still remember going to school in grade 7 or grade 8, and you could always tell the rich kids, they were the ones that came to school with braces. Mm-hmm. And people were conscious of that. You know, you're really conscious when you're 10, 11, 12, 14, 15, 16 years old. You know, I had crooked teeth, and I couldn't get I got braces when I was 17. I got a part-time job and I paid for them myself. So I paid $40 a month, and I was embarrassed, to be frank, because that was quite late. Nobody really had braces when they were 17 and 18, but I did. And I never forgot that. And then the other part of the story is we started working on pharmacare first. And pharmacare is a really crushing need in this country. But I have to tell you, every time I would talk to someone about pharmacare, someone would say, well, that's really important, Don. I'm glad you're working on that. But you know what we really need in this country? We need dental care. Mm-hmm. And there's actually more people that don't have dental insurance than don't have pharmaceutical coverage. Mm-hmm. So I'm not playing off one to the other. We absolutely need both. But I think the lack of dental care, for the reasons I mentioned earlier, you know, the fact that it's on our face, the fact that you can't avoid it, the fact that it's linked to other health issues. You know, the truth is you can actually skip a prescription here and there. You can actually find alternate treatments. But if you've got a primary dental problem, there is no avoiding it. And, you know, if you go to a job interview and you're missing your front tooth, people make assumptions. You know, people are embarrassed. I've had people come to my office, seniors, that have no teeth, none. Mm-hmm. And they can't eat mm-hmm. properly. And, you know, every time I try to find someone who can do something for them, there's nowhere to go. Mm-hmm. I've tried the UBC dental students. We've tried pro bono thing. We've tried all sorts of things. We can't get those kind of people dealt with. And I think, frankly, in a G7 country, in a country as wealthy as ours, that there shouldn't be a single person walking this country that should have to live with pain, that should not have access to primary health care. Like I said, we cover you from the tonsils back, and then we've carved out this piece of our body and don't cover it. It's absurd, it's anomalous, it's painful, and it's time to change.
Totally.
Mhm.
Can I speak to Mr. Davis? Can you hear comments from audience?
Go for it. Yep.
Question? Sorry, I'm not sure if you had my picture on. I was a bit late getting in. Really, congratulations, Don. You can hear from my voice. Originally from England, where we had a National Health Service and everyone was covered. Some of the people on the audience may be aware of who I am and what I've done. 15, 16 years at UBC, and I used to bring the students down to REACH Clinic all the time. I was one of the founders of the Kool-Aid program over here. I helped downsize Woodlands and Glendale. I have, and don't hold this against me, the dental consultant for the Ministry of Health and the government, all governments in BC, for about 20 years. And probably the one that I'm proudest of, and just to let you know, I've spent my whole life on this and would love to help you around it, was the only Canadian that was asked to go and tell the Canadian story when Hillary Clinton was trying to put together her healthcare plan in the States. And I was invited twice to go and talk to them about healthcare, dental healthcare in Canada. So I'm really excited where you're going. I was around even when we had the first dental plan here in BC in 1980 with Mr. Bennett. It was costed out at 25 million, and after a year it was 100 million. And it was the first one that was cancelled, unfortunately. So in developing this plan, and I live in Victoria now, but perhaps we can arrange to meet if you would like in Vancouver. You've got to be so careful how you plan these that the costs just don't run away. We have read in the papers now that it went from a 5 billion to a 9 billion potential program, and that gets people nervous. One of the key things you're going to have to think about is, for dentists to sign up on this program, are you going to demand that they don't balance bill? We have a Healthy Kids program here, and it all sounds nice, they're all covered, but almost 80% of the dentists treating them will want extra money. And that is an access issue. There are a lot of people that don't go because they're frightened of that extra money they're going to have to pay over and above even what is covered under Healthy Kids. So unless you build in some pretty strict things at the beginning, it can get away from you very quickly. Everyone's going to ask, are you going to cover orthodontics? Well, that's often cosmetics, so you may or may not. But anyway, I just wanted to say I came on this call, sitting home really, really excited that finally something's happening, and well done on it. There are a variety of claims you make, and there are some very good dentists around, and quite a fair amount of pro bono that goes on. And some of the comments you made are not quite right, but well meant, and you need to bring them forward. So just on a personal basis, I'm really excited where you're going. And I think I may have some things that might help you to push it along a little bit. So I'll leave it up to you whether you contact me at some stage.
Thank you, Malcolm. Okay, so we'll leave more of the questions for the end. That way we make sure that all the speakers have equal time, unless there's a burning question. We'll transition. Does that sound good, Dawn? Did you have any final thoughts, or you've got what you needed to say? I know you'll have more to say probably as we go on, but it sounds like it came through really clear from my perspective as a dental hygienist analyzing this issue now for 20 some years. Thank you, really good information. So I'll just advance the screen to Karese Mahnic as the dental coordinator for REACH Community Health Center. Go right ahead.
Thank you, Kimberly. And thank you, Dawn, for speaking about this important topic. But I also wanted to take a moment to thank everybody for joining us today. My name's Karese, and I will be speaking about how the National Dental Plan would affect our office, REACH Dental. So REACH Dental has been serving the public since 1971. We provide a community-based care to a variety of different patients. So homeless, Indigenous, we have people with disabilities, low-income families and individuals, refugees, and other people in the community. At REACH Dental, we follow the BC Dental Fee Guide, but we do also provide discounts to those of low income and who don't have any coverage. So currently we have about 16% of our patients that are receiving the discount at our office. But in addition, 38% of our patients are receiving government assistance. So through the Ministry of Social Development and Poverty Reduction. So they either receive income assistance or disability, which do both provide dental coverage. At our office, we do write off the patient difference, while other offices in BC either don't accept these plans at all, or they ask them to pay 50%. When it comes to the National Dental Plan, the groups of people that would be affected by this would be firstly seniors who don't have any dental coverage, but also seniors who have ministry coverage that's terminated after they turn 65. A lot of our patients who are seniors have to pay out of their own pocket and sometimes aren't sure how long they can continue their dental cleanings appointments with us due to the cost. So with that being said, the longer they go without one, the greater risk of periodontal disease progressing and affecting their overall health. But the second group of people would also be individuals without any dental insurance through their employer. So we often do see a lot of our patients who don't have dental coverage through their employer as they don't provide one. And a lot of the times they aren't able to afford to buy their own dental coverage just because it is an added monthly expense. I do see a lot of employers that do offer health spending accounts, but even then it would not cover the cost for a regular dental cleaning. And they're usually a low amount and can be used for other health services as well. But the last group would be low income families and working poor individuals who would be affected by this plan. Most people who can't afford dental insurance don't normally think about saving for their regular routine appointment. It's usually used for either like toothaches or emergency situations. So when they're in pain, just because they use their money for other necessities. So like clothing, food, transportation, housing, etc. So dental cleanings and checkups are not usually a priority for them due to their budget. But this national dental plan would benefit REACH as a whole, as our community, just because we'd be able to subsidize other patients in need. Because a lot of the times, a lot of our patients still can't afford the dental treatments that they need, even after the discount that we offer is applied. So meaning this would help people in our community and allow them to have accesses to the other services. So these extra funds would help other services we have at REACH and to support the people while addressing social determinants of health. This plan would also allow patients to have early detection by doing exam and x-rays to prevent patients to lose their teeth. It would allow them to get treatment done early instead of their teeth worsening. When the teeth do worsen, that would result in needed extractions followed by an extensive treatment, which can get quite costly. So like dentures, implants, bridge, to replace those missing teeth. But if they're able to get early detection, it may be a filling, which is a more economical solution, or they would not need treatment at all. But the National Dental Plan would benefit the community, especially those of low income and seniors. It would allow our clinic to support those in need and to allow them to have access to the other services. It would allow the patients to maintain their overall oral health by having regular routine appointments and to prevent extensive treatment. I do think that it's a really important matter for all. But with the prepared plan by the federal government, I do think this is a great step in the right direction. But yeah, that's all. That concludes my presentation. I thank everybody for listening. It's hard just because there's so much unknown right now, but I think this is the right step in the right direction for everybody. But yeah, thanks for all listening. And if there's any questions, I think there'll be time at the end for those.
I have a bit of a burning question.
Yeah, yeah.
Obviously there's two models to this. One is that somebody comes in with a card, like a care card or, the dental plan card, and they hand that to you to pay for their care. And it's kind of a fee for service kind of model. Or, and then how do you pay your staff versus a model where there's some global funding coming. And I think that this plan is most likely to be set up as a fee-for-service kind of idea, where they're going to have that same kind of idea of a plan. But we heard the concept of balanced billing. So my understanding of balanced billing here in British Columbia is that there's no policy, it's silent. So there is no written policy in British Columbia that a dental office can balance bill or cannot balance bill. It's not prohibited, it's silent. Whereas you go into other provinces and there's actually a framework that says, no, it's prohibited. You cannot balance bill these public dental plans. So I'm wondering about that, Dawn, and whether that discussion is coming forward at the federal level about how are we going to prevent this balance billing issue? Because I just actually had this story yesterday. My son's friend, 9 years old, broke his front teeth right off, and they're his permanent teeth. So the cost of paying crowns, bridges, implants, root canals for a 9-year-old who's growing. And what was interesting is the parents have 2 dental plans. One is in the teaching system and one works for the city of Richmond as a maintenance worker. They both have insurance plans, both parents. They were only being covered about 40% of the specialty fee to fix this child's teeth. And this is going to affect this child for the rest of his life. So that's just one example. This is a family with 2 insurance plans, and they still are out about $1,500 for this child's teeth. And this is just the beginning. This child's going to need ongoing work. So it's quite interesting. And so they were obviously balance billed significantly because a lot of offices are charging above the fee guide or what the dental plans pay. So I think this is a very important example of what you were talking about, is the fact that you're not balance billing as a clinic. And of course, those that can afford to pay or those that have insurance plans, you guys are taking that full fee. And then of course, you're using that ability to provide other people that don't have the ability to pay with that's where you're giving your discounts and stuff.
Yeah, exactly. Sometimes we do see plans where with like root canals or extensive treatment, it's considered major work. So sometimes it won't cover as much as basic work. So basic sometimes could be like 100% or 80%, but then when it comes to more extensive treatment, so like dentures, implants, all of that, sometimes implants aren't even covered because it's considered cosmetic, or there's dentures or there's crowns, which would only be covered at 50%. Or sometimes if they have a student plan, it's not covered at all. So there is sometimes patients that are still have a big bill to pay at the end, even if they do have dental coverage.
Kimberly, just a quick comment on what you said about that. You should be aware that, and particularly in BC, any work done in hospital dentally, not fillings, under MSP, it is against the law to balance bill, and that will be followed up. Unfortunately, our individual programs through other ministries, like the ones we've talked about, those ministries are not prepared to say no balance billing because they're keeping their fees very low. And they know that the next thing would be, okay, we want an increase in fees. And as you know, the dental profession, and Chris, you'd know this, went up 7% over the actual fees that you're getting in this year. And you haven't had that paid for by the others. And so that's why you get this enormous amounts of balanced billing. Is the differential. And it was good to hear from Don that he hoped that he would be able to have a fair fee for the dentists, and that would stop a lot of this balanced billing. But and by the other way, there isn't any province in Canada that pays for implants. No one covers implants anywhere. The only place implants are covered, and we cover that, would be at the Cancer Agency as a result of a cancer rebuild after resection of the jaws. But people don't pay for implants, unfortunately, anywhere.
Okay. Well, I think we'll move on unless you had any final comments, Karese, to the next speaker.
Excuse me, could I just ask, what does balance billing mean?
Oh, balance billing is when you go into an office and the insurance plan covers, let's say an insurance plan covers the cost of a filling at X amount of dollars, but the office is charging more than that. Because they've chosen to set their office fees a bit higher than what the dental plan covers. So that difference, they'll often charge to the patient directly. So even though, Even though they
Experience.
might be, yeah, even though the client might be eligible for public dental care under the Healthy Kids program, for example, because it's a low-income family and they fall under a certain income cutoff to be eligible for the Healthy Kids program. A lot of dental offices, if you go in with your Healthy Kids program eligibility, they charge more than what that dental plan reimburses for that particular filling. So they'll balance bill the family directly. So it might be 20%, it might be 30%, it might be as much as 40%, depending on where that office has set their fees, and also depending on the fee guide that the dental plan is choosing to reimburse at. Some of the government plans are reimbursing below the provincial fee guide that say BC has set by dentists. The organized dentistry does set the fee guide that they are asking as a member organization. The BC Dental Association and the BC Dental Hygiene Association do have their fee guide. The government plans might actually reimburse at slightly lower than that. And then of course the offices may choose to be running at above the fee guide. So when you consider that an office, if this is the BC fee guide here, the dental plan maybe only reimburses down here, and the office chooses to bill out here, there might be actually as much as a 40% difference. And so that's kind of what, some friends of mine just experienced. And I hear this story all the time. So even people that have, for example, a double insurance plan may still face an amount that they have to pay. And so somebody that has one insurance plan will definitely face that issue. And people that have no insurance are paying the full amount. So it can, when people think, oh, does a nonprofit actually come out less cost? It can, because nonprofits typically charge at the fee guide, not above it. So right there's a savings by a nonprofit that's following the fee guide. And then also the nonprofits often offer a discount, and they accept the plans, the public dental plans. So the nonprofits are, they're struggling to survive financially because of the cost of dentistry. It is expensive, but they're trying to offer that in a more nonprofit based sense. And they still have to pay their staff.
Kimberly, another thing you will be interested in is it's very good, and our plans at the moment in BC will pay independent dental hygienists and their practice. They whether they like the fees. Some of our provinces, and you may know better than I do, many provinces don't even have independent dental hygienists. So this plan will need to decide, and it may be different province by province, who are we prepared to pay for on this plan? And then the other thing they will have to decide, there are many low-income people actually who do have dental plans just because of the type of work they do. Who is going to be the first payer and who will be the second payer in the plan? Do you go to the federal one first and then top up by the second, or the second? So those sorts of discussions, and I will talk to Don later about some of those things. They're going to be the difficult issues.
I was going to interrupt for a second. I apologize. So
Sorry, I jumped in. I do apologize.
No problems. I'm a dentist in Ontario, but I've been active in the design and implementation of government-sponsored dental programs for over 38 years through the Ontario Dental Association. In terms of fee guide, at least in Ontario, and I know in a number of other provinces across Canada, the fees are established by doing a survey of a couple of hundred offices to see what the actual cost is to perform each service. And the fees that are offered here in Ontario under the government programs are at 37% of the current fee guide.
Yeah.
There hasn't been a fee increase in Ontario since somewhere in the early 2000s. Yet our Ontario government has gone out and spent money on buses and infrastructure. We'll get into that later. But just to let you know that if our college here has said that if you are going to bill above the fee guide for a procedure, the Ontario Dental Association fee guide, you better have a very good reason as to why you're providing that service over and above what the fee guide is. So the fee guide sets the ceiling. Now, a number of my colleagues, including myself, bill at or below, depending upon the financial needs of our patients. And yes, I still do see patients, especially patients with special needs, that are covered at 37%. So it's not just I'm not making much money, it's I'm taking a loss without a charitable receipt. And I've been doing that for a long time. And I've been watching our government take valuable funds and fritter them away on really dumb ideas, which we'll talk about later. But I just wanted to make it clear, the fee guide becomes the ceiling, and it's established by looking at the cost of practice. And it's an extensive survey that's done to look at how much the costs are to actually run a practice. And it's done in Ontario, I think in BC as well, by a company called RK House. So they establish what does it cost to open the door and to provide the staff and the salaries and all the protective equipment and all the rest of it. So just to let you know that that's how I perceive it.
We used RK House, as many provinces did, and had the same thing, time factors and the fee schedule. And thank you for what you're able to do. And some dental offices just aren't prepared to do that, I'm afraid. And we're like you, less than 50% of the fee schedule. So the office says, Malcolm, I'm losing money. Every patient I see, my overheads are over 50%.
Okay.
It would be nice to be recognized by government, the fact that we are actually doing this, and we'd like to sit down with government. And it was very difficult in the years I chaired the committee to talk about the mix of services, and also how do you detect, monitor the outcomes of these programs, which we'll talk about later, because the data that was used to develop the program, in my opinion, was not very well gathered, but I'll talk later. So thank you for listening for me.
Okay, thank you very much, Stephen. Stephen, I feel like I've seen you before, but I'm not too sure if, you said you were from Ottawa?
No, I'm a Toronto.
Oh, Toronto.
I'm a Toronto-based dentist, active in the Ontario Dental Association and the Canadian Dental Association. I sat on their basket of services committee because they began to work on what a national fee guide, a national dental plan would look like a number of years ago. And they put it together with the basket of services, the frequency, and it would be a good idea if government actually sat down and asked them to look at it. And provincially, we've looked at these things too, to look at what are the essential services to establish oral health and to maintain it.
Sorry,
Okay.
I'm just passing my other meeting. No,
Is
mainly.
that Lex?
Oh, sorry, I'm just passing my other meeting. Regarding the attachment, when I was at the auto,
I think you're muted, Lex. It says muted on my screen. You need to unmute yourself.
I think he might be actually on 2 meetings. I think that maybe he did say he would be stepping out at about 6:30. So he probably just muted for us for that reason.
Okay, thank you.
Okay, so I'm going to move on to Brandon next, who is the founder of the Coalition for Dental Care, which is a group of, it started off with dentists and dental students, and then it's grown into dental hygienists and other allied healthcare people. We have some physicians involved who have been advocating for universal dental care, which is for everybody. Not necessarily a targeted program.
sorry, yes, that makes sense. Sorry, I'm trying to jump in between meetings right now.
Oh, hi, Lex. And he has been working with this group, and one of the platforms that they're using is social media to get their message out. And so it's very interesting to follow the work that they're doing, because there's a lot of young people in this organization who are able to reach people in ways that a lot of us older folks aren't quite as savvy with. So it's been very wonderful to have Brandon speaking to my students at Vancouver Community College, and I know he's been doing the same across the country. So Brandon, do you want to take the floor?
Sure. Thank you for the introduction and for inviting me as well. I think just to introduce myself, my name is Brandon Doucet. I'm a practicing dentist in Nova Scotia and founder of the group Coalition for Dental Care. I think it would be good to start off with just a kind of a description of how dental care is structured in Canada, why we have the outcomes we do, and kind of where it seems like we're going, where we need to go. So really starting off, in Canada, people rely primarily on their work-related insurance, out-of-pocket payments and stuff like that to access dental care. In fact, that's the overwhelming majority of dental spending at about 95%. And only a meager 5% of dental spending goes towards targeted government programs. And this is actually a really low number. If you compare the public dental spending as a share of total dental spending in Canada versus other developed countries, we're second last. And this is something that we like to be smug in comparison to the Americans, but they even do better than us in this category, and they're at about 10%. And if we look at countries, say like Japan, they have about 75%. So what we see with this very low level of public dental spending, we see very large inequities in access to dental care. So very different outcomes for high income and low income groups, because low income people can't afford to go for regular treatment. They need to focus their money and resources towards dealing with pain and infection. And that's where we see the numbers that's already been discussed of 1 in 3 people lack any form of dental insurance. I think it's important when we talk about that, that doesn't mean the other 2/3 of the population are okay. Many of them still struggle to make the co-payments and stuff like that, but it gives us a general idea of 1/3 of the population has to pay for dental care out of pocket. And that's a really big barrier as far as accessing care. And over 1 in 5 people avoid the dentist each year because of financial constraints. And these are massive numbers. It's not the odd person falling through the cracks, but rather major segments of the population. And that's because we structure dental care in Canada like the Americans structure their healthcare system. And these are numbers that we need to put in context. They're actually increasing, not even just since the pandemic, but even before that, because of the nature of work-related dental insurance. We're seeing fewer employers provide benefits like dental insurance, and we're seeing a lot of older people retiring and losing those work-related benefits. And the pandemic is just something that puts this into hyperdrive because of the financial crisis. People lose their jobs, lose their benefits. They don't have a safety net to fall back on. And it's really been a moment in time when a lot of people are suffering. Access to dental care is worsening. And if we don't steer this ship in a different direction, people are going to suffer even more than they already have been. So that I am happy with the announcement for a federal dental plan. And the NDP dental plan that Don was mentioning would about triple public dental spending in Canada. This would be the largest investment in oral health in Canadian history. I see it as something that needs to be a stepping stone to something greater, but for the about 6 million people who would benefit from this program, this is very urgently needed. And the plan is structured in a way that would help fill many gaps in coverage in the population in a way that a lot of the existing programs don't do. So this program is for uninsured families making below the income of $90,000 per year, below $70,000. There's no co-payments. Many of the targeted programs we have are specifically for people who are on a low income where it's like below $30,000 per year, or are specifically on social assistance. So even, and a lot of times when we look at provinces, we think, oh, they have coverage for children. Well, the reality is a lot of the times it's children on social assistance, children from families with a low income, and things like that. So there's a larger gap between those people who are eligible for the public program and those who can actually access care privately. So structuring the plan the way it does help fill those gaps in a more efficient way than we currently do. And it would be very helpful for, say, as it's already been mentioned, like adults who don't have benefits with their work coverage, and seniors who lose their coverage when they retire. But it is also important to say that in the long run, we need to move towards a universal dental care system. And really, a lot of this boils down to the politics of targeted programs versus universal programs, because with targeted programs, people tend to be seen as getting free stuff because not everyone is eligible for the programs. And it makes these programs more easily underfunded, which this can take outright, you can outright defund the program, but in a lot of the times it ends up being, the fees are de-indexed from inflations. We cut services that are, procedures that are covered. And over time, these programs kind of wither away. Maybe they become programs that once were for all uninsured people, now they're only for people on low income. They get undermined in ways. Whereas universal programs, there tends to be a broad buy-in from society as a whole, because everyone relies on these programs, which makes it so that when you try to underfund the program, it's seen as an attack on the society as a whole, which then faces much broader backlash. So even within, just the political sphere, we need to be working towards a universal system, not just to achieve a certain level of funding, but actually make sure that that stands the test of time. And we also need to look at addressing some problems as well, where a lot of people who rely on targeted dental programs now struggle to find a dentist who will accept them. This is because of the low fees paid out by the programs and many other factors at play here. But it's something that integrating dental care into our universal healthcare system makes it so that everyone's relying on the same program. You can't discriminate against people because one person has a private plan versus another person has a public plan. Everyone's buying into that same system, and it makes that kind of a level playing field for people. And we also need to look at alternative dental delivery models as well, where we're not just relying on private practice in the fee-for-service model, where kind of dentists are at the center. We also need to look at alternative models that use providers like dental therapists, which are mid-level dental providers that can do procedures like fillings, simple extractions, cleanings, all at a fraction of the cost of a dentist. And this is something, the comparison I like to use for this is it's kind of like a physician and a nurse practitioner relationship is kind of like what a dentist dental therapist is. So, there's room for both of them on the dental team, but I think expanding dental therapy and bringing that into the mainstream in Canada makes it so that people don't just have access to a dental plan, but they actually have access to comprehensive coverage, because we're increasing the workforce in a cost-efficient way to make sure that people aren't just coming in for a toothache when they have the public dental plan, but they can actually receive comprehensive care.
Thank you, Brandon. So what I was just thinking about, I was just reflecting on this notion of the triple expenditures. So right now we know that I think we're probably around 15 billion is the total cost of expenditures for dentistry in Canada, which is mostly private, 95%, and only about 5% public. So that 5% is the part that we expect is going to triple with the investments in this national dental care plan. And so if we're going to spend our money wisely, I think this notion of looking at our workforce and making sure that we are efficient with the scope of practice. And we've seen that with nurse practitioners having a certain scope of practice where they can provide a certain level of service. And then that way our physicians are saved for those services that require that extra expertise, and sort of layering the services and the cost of human resources. And I know Lex at his clinic, I actually work at the Vancouver Aboriginal Health Clinic with the dental hygiene students as volunteers during the month of January to March, April. And of course, we don't have dental therapists because they're not provincially allowed to practice on provincial land. They're currently restricted to working on reserve. Which I think is a travesty. And I think when we look at the skills of a dental therapist, being able to drill and do fillings and basic extractions and open and drains and pulpotomies to take people out of pain, we need to be able to provide access to this type of provider. And so fortunately, the University of Saskatchewan, in partnership with Northview College and Saskatchewan Polytech, have just announced recently the launch of a 2-year degree program to train dental therapists in Saskatchewan. And I think they're going to be quite happy to have people coming from out of province to get that training and to go back to other communities in Canada. But I think this is another piece of the puzzle, is that we need to have this training available as broadly as possible across Canada so that we can have these providers available. Because, certainly we know that seniors in long-term care do not have providers coming in. I work in the long-term care area, and I very rarely can find a dentist that is willing to come out to serve that population. And so if we can have a provider like a dental therapist serving this population in a much lower cost way, providing some of those basic needs for people that are at a different level of need in their life, where a lot of them are having pain and unmet treatment needs. So I think this type of a provider would be absolutely a big part of decreasing the expenditures or making it more efficient.
Kimberly, I just have to, please be cautious when you call things a travesty. The dental therapists were established in Canada to provide much needed services to First Nations populations. And that's where they've been restricted because there's so few of them. And the actual program that was closed down that I visited many years ago in Saskatchewan was closed down because Saskatchewan Dental Association was the only one across Canada that said, we can hire those therapists as well. So the federal government was paying for training for therapists, and the therapists were going off into private practice because it was beneficial to the dentists in Saskatchewan. The new program has said that is not happening. There is such a shortage of therapists for First Nations populations who themselves can't get dentists to go in. It will be a lifetime of 15 or 20 years before there's going to be therapists that are going to be available. I agree entirely. I like the dental team, and if we can accommodate them, but it's not going to happen with therapists, unfortunately, for many years.
It takes time to build up the dental therapy workforce, but I also think it's worth noting that there are, I don't know the exact number, but well over 10 or 20,000 dental hygienists in Canada as well. There's alternative models that could more rapidly expand the dental therapy workforce by looking at like a dual degree dental hygiene, dental therapy degree.
Yeah, that happens in the States. There are at least 3 programs that are dual, and that happened with the new cross dental therapists in England, who actually did look after the children's population there. They now train it as a dual dental hygiene, dental therapy program. You're dead right, Brandon.
Yeah, and I think that curriculum blueprint has existed in Canada now for a number of years. The Canadian Dental Hygiene Association has written a dual dental hygiene, dental therapy blueprint. And the most efficient way to add the dental therapy skill set would be to expand already licensed dental hygienists with those skills. So absolutely that model is another model of education that we need to look at. Any other comments? I think we're moving into the question and answer period. So I want to open up the floor for people to, I'm getting sunned here. The sun is coming in at the wrong angle suddenly, so I'm rotating. So I'd like to open up the floor to people to pose their questions in the chat, and you know, your stories as well. It doesn't have to be a question. It can be a story, your perspective on some of these issues. And I would encourage you to please remember to also document those in the answer to the questions on the Jamboard later formally. But I think having that rich dialogue is really important verbally, and to share that, certainly if you would like to speak with your camera on, if you can, but if you can't, you can just speak with your camera off. So the chat's looking very busy with some comments. So we're at 7:21. So there's just some comments in general. Does anybody have a particular question or something they wanted to lead with? I see 4 dental therapists in existence here in BC, Ashley. That's how many we're down to?
Yes.
Yeah.
And all working on First Nations land. And that's why it was established that they couldn't work on anywhere else in BC.
Does anybody have a question or something they wanted to add? I see a hand up with, is it Patricia?
Yes.
Patricia, go ahead.
Yeah, I'm a retired social worker. I still do a lot of social work at home. unofficially, and I call it Patricia's very busy support service. What I mean is just friends and people in the community, because I know how to resource things, because I know how to, make the right calls or find out how to access the questions on your pension plans and on housing issues and stuff. So I'm just wanted to bring in, I think there's been I love the discussion, and there's been a great range of people and issues talked about that is tremendously encouraging. And I'm just wanting to mention that among the people that I know, there are much worse income levels than I've heard spoken of here. Among seniors, there are lots of seniors I know of whose income is $24,000 a year or less, and who's are just people who lost their insurance plans or any kind of care when they retired from a job. And so I know of people who have had no dental care for 20 years or something like, or 15 years, and whose teeth are in a terrible condition, but can't do anything about it, just lament and wash their mouth with Listerine a lot or something. So I mean, it's really urgent, and I'm very, very encouraged that there's so many excellent people here working on this. That's all. Thank you.
Hey, Kimberly, I see that Jane has asked a good question.
Jane, go ahead.
The question she put in the chat was, what can the average Canadian do to ensure that we get this universal dental care up and running?
Thanks, Bill, before I ran out of time for my mute. And that's to our panel. What can we do?
Well, if you don't mind, I could start. I think just keeping up the public pressure, trying to do whatever we can to raise awareness for these issues. We at the Coalition for Dental Care have been trying to do a lot of social media work, but that's something that, I think a lot of the times we're kind of preaching to the choir to some extent. So we're trying to find different ways to reach out to people who aren't necessarily politically involved, aren't already on our team, and trying to do kind of more in-person things. So.
Can you hear me? I'll just make a comment on this. Can the rest of you hear me?
Yes.
Okay, I was going to say, I mean, we must support Don and that small group. I mean, the biggest thing is for that group to keep pushing, and it might not be the best plan to get something off the ground. Because I guarantee if we did a little survey here in BC of the thousands and thousands of people now who don't have a general practitioner, you said to them, well, where should we put our money? Should we get you all a family doctor, or should we get a dental plan? They'd vote for a family doctor, I'm afraid, at the moment. So the timing of these things, sometimes they come up at actually the worst possible time. So I think it sounds like Don has really got this going, and I think we just try and do everything we can to support him.
So I hear what you said, Michael, but Malcolm, but the BC government really isn't in control of how many family doctors are out there. That's partly the doctors of BC and in how many residencies and so on. But I'm talking about the average Canadian who really understands that dental care is part of our healthcare system. I have Crohn's disease. My first indication that my Crohn's is coming up is my teeth go funny.
Yeah. Yes.
I know. It's just, it's there. I get it. I know what it is. So I want to make sure that everybody understands that connection between that it is primary health care, as Brandon said and Don said. And so what do we do? And there's one thing to lobby our politicians, but they get it. I'm sort of thinking about the local town hall, sort of focus groups, phonings, those terrible talk shows that people tend to rant on about. But it's all of our responsibility to make sure that everybody understands the information that we heard tonight, which is really important information, that it gets out to Canadians. And so what can we individually, but also collectively do? And I know that Brandon's mentioned social media, and for anybody under the age of 50, go at it, not me. You know, let's go from there. But ideas sort of generate at this point. How do we develop a groundswell of support for this program? Because it'll die. When you get John Horgan, our premier, saying, "I'd rather have a doctor than dental care," he doesn't get it, and we need to counter that.
Mm-hmm.
Done.
Thanks, Colleen. I think we do have to use media. I think the problem with dentistry is we've never gone to the media. We have always tried to go through this battle behind closed doors. We've never used the media. I have been begging our profession to go to the media for a long time now to say, look, we need to get the public to know about us and about what dental care can do for people. And so I think that we finally brought that out of the box. And I do have to give credit to the Coalition for Dental Care for basically pulling us into the media. And I think the pandemic created that situation. I've heard so many people recently take note of dentistry, which they had never done before. So I think part of it is the pandemic and the fact that dental professionals were highlighted in that way new in an interesting way, just because of the pandemic. But also I think the social media presence that we're starting to see is making a difference. And more dental professionals in their private practices, when they were shut down, they turned to social media to get their word out there that, like, we're still alive, come see us. And so I think for the first time, the public sat up and thought, oh, wow, we need to look at this. So I think this is something we just need to continue to build on. And for those of you that don't use social media, but you care about this issue, maybe this is a reason to learn to use the tools. I think that having our elders involved in using social media amongst their group can help to raise awareness, because I do know so many seniors now that are using social media. And I work with the senior center here, 2 of them in the Vancouver area. Both of them communicate to their members using Facebook and Twitter. And that's how they get their messages out there. And so email seems to be falling by the wayside.
Kimberly and all of the people who have presented and spoken tonight, I would like to thank you a great deal. This is a long conversation, and this is the start of it, and it's maybe one of the more encouraging developments in an awful long time. And so I'd like to bring the meeting to a close right now. And
I'm going to share the link. And I'm going to let people log on to the link for the Jamboard. So
wonderful.
Don't go away because you'll want to have that. So 1 sec.
Thank you kindly. So maybe while Kimberly's doing that, I'll just thank the people that I need to thank for tonight's event. Wanted to start with Elder Tom Ullman for the land acknowledgement, and to our presenters, Sarah Clifford, Don Davies, Karese Mahnic, and Brandon Doucet. To Kimberly for stepping up and doing such a fabulous job of moderating. You clearly understand this issue and have a great deal of experience with it. To Daniel Cook and Kylie Ellis for the tech support to make this happen for a techno peasant like myself, and for Maho Okada and Nicole Amir for the infrastructure and communication support at REACH, and to the staff at REACH. To Colleen Fuller, the elected chair of the board of REACH right now. And finally, to all of you for being here for this really important conversation. And this is not going to be the last you will have hear about it from REACH, but thank you very much. And as Kimberly said, please go to the link and put your comments on the chat board.